Dear students, now I will be talking to you about the topic pericardium. So what is pericardium, and then what are the relations of it, and what are the contents of it, and its clinical importance we are going to discuss. To make you understand the clinical importance of pericardium, I am herewith presenting a clinical case scenario. A patient of 35 years came to the medical OPD with a complaint of mid-sternal pain of 2 weeks duration, and the pain is more when he is in lying down position or in supine position, or when he coughs or takes a deep breath. So, patient of 35 years age with a complaint of mid-sternal pain of 2 weeks duration. The pain is more in lying down or supine position, or when the patient coughs or takes a deep breath. The pain is relieved in sitting position. Pain is also felt in left shoulder. Patient gave a history of sore throat prior to the onset of present symptoms. After thorough examination and investigations, it was diagnosed as acute pericarditis. After listening to the lecture, you should be able to answer these questions. What anatomical knowledge is required to diagnose this condition? How will you explain the relief from the pain which the patient is getting when he is in the sitting position? And why the pain is referred to the left shoulder? These questions you should be able to answer after this lecture. After listening to this lecture, the student should be able to define pericardium, its location, name the layers and their description, relations of pericardium and contents of pericardium. The student should be able to define what are sinuses of pericardium and describe them, blood supply and nerve supply of pericardium, clinical importance. These are the learning objectives for this session. In this picture, you are seeing the heart with enclosed pericardium in the middle mediastinum, and you can identify the anterior mediastinum, the posterior mediastinum, the inferior boundary and superior boundary of the mediastinum. Now let us define the pericardium. Peri means around, cardia means heart in Greek. So it implies that the word pericardium is derived from Greek. And in this picture, you can see this white wrapping around the heart and the beginning of the great vessels. So this is the ascending aorta and arch of aorta and descending aorta. This is the pulmonary trunk which divides into right and left pulmonary arteries. This is the superior vena cava which enters into the right atrium of the heart. We can define the pericardium as a conical, 3-layered, fluid-filled fibro-serous sac that encloses the muscular heart and the roots of great vessels like the aorta, the pulmonary trunk, the pulmonary veins, the superior and inferior vena cava. So you can see it. So it is its shape is conical and it has got 3 layers One is a fibrous layer, the other is a serous membrane. The serous membrane will have two layers, the parietal layer in contact with the fibrous layer and the visceral layer in contact with the heart, and the space between the parietal and visceral layers known as the pericardial cavity, which is filled with fluid, and it encloses the muscular heart and the roots of great vessels, the aorta, pulmonary trunk, pulmonary veins, superior vena cava and inferior vena cava. What is the location of the pericardium? The heart is located in the middle mediastinum. So, the pericardium, which is enclosing the heart, is also in the middle mediastinum. So, the location is in the middle mediastinum, and the extent of vertebra or the T5 to T8 vertebra, which is the posterior boundary for the mediastinum. And anteriorly, it is related to the sternum and costal cartilages. So, anteriorly will be the body of sternum and the second to sixth costal cartilages. In this picture, you can see the heart enclosed in the pericardium, and the great vessels, the superior vena cava are seen and the arch of aorta are seen. And in this picture, you can see the anterior part of the pericardium is removed, so that you can see this heart and the great vessels. Now let us see the layers of pericardium. Before we consider the layers of pericardium, see this picture. The closed fist is pushed into an inflated balloon, and there is that part of the balloon wall in contact with the fist is the inner layer, and that is away from the fist is the outer layer of the balloon, and between the inner and outer layers is the air-filled space. Let us apply the same thing to the pericardium. And the heart, if you observe, in contact with the heart there is a layer of pericardium, which is the visceral layer of pericardium or epicardium, and away from the heart is the parietal layer of the pericardium, and in between the two is the pericardial cavity. Hope you have understood what is parietal layer and what is the visceral layer of pericardium. So, the layers of pericardium are the outer fibrous pericardium, the inner serous pericardium, which is divided into a parietal layer which is in contact with the fibrous pericardium, and the visceral layer that is in contact with the heart. So, the heart is within the fibrous pericardium and outside the serous pericardium. That's why we say heart is intrafibrous and extraserous. Let us see how the intrapericardial structures enter the pericardium. The heart and roots of great vessels, they are inside the fibrous pericardium. Follow the greenish one in this picture. So their heart and great vessels, the roots of great vessels, they are inside the fibrous pericardium and invaginate into this serous pericardium. Invaginate into the serous pericardium from above and posteriorly. So hence, though they are intrafibrous, they are extraserous. Observe the parietal layer of pericardium on the inner aspect of the fibrous pericardium, and the visceral layer in contact with the heart or the myocardium. The visceral layer is also called epicardium, and at the roots of these great vessels, observe that the visceral layer and the parietal layer are continuous with each other, so hence forming a closed pericardial cavity between the two layers. That's why we say heart is intrafibrous and extra-serous. Now let us revise the layers of pericardium. So the layers of pericardium from outside inwards are the fibrous layer, parietal layer of serous pericardium, visceral layer of serous pericardium. In this picture you can see from outside inwards the layers are the fibrous pericardium, parietal layer of serous pericardium, pericardial cavity, visceral layer or epicardium you are seeing, then the myocardium and the inner lining of the heart, that is called the endocardium. So now it is understood the arrangement of layers of the pericardium. And coming to this picture, you can see the heart enclosed in the fibrous pericardium, and see its shape and see its continuity with the central tendon of diaphragm below, and you can observe the roots of great vessels. So this is the arch of aorta covered with the fibrous pericardium. And now let us see what is fibrous pericardium. It's a tough, fibrous, non-distensible. It's a tough, non-distensible, rigid outer layer, and it is shaped like a cone. And apex is below. This is the apex of it. And the base is above. Its extent, if you see in the midline, it is extending between the manubriosternal joint to the xiphisternal joint, and its left border is more oblique. It is running downwards and laterally towards the apex of the heart. Its right border, if you see, it is less oblique and it is curving downwards. Observe the left border and the right border. And below is the apex of the heart. That is the extent of it. And if you see it above, it will be going up to the sternal angle, the junction between the manubrium and body of the sternum, which corresponds to second costal cartilage. Up to that, it will be extending above. Then let us see the fibrous pericardium attachments. So it is attached below to the diaphragm, and it fuses with the central tendon of diaphragm, and above it is continuous with the outer coats and the arch of aorta and pulmonary trunk. So the outer layer of a blood vessel is tunica adventitia, and here also it is continuous with the outer layer covering the arch of aorta and pulmonary trunk. Not only that, it is continuous with the pretracheal layer of deep fascia of neck at the sternal angle. That is the attachment of it above and below, and anteriorly or in front. It is connected to the sternum by sternopericardial ligaments. And the fibrous pericardium is forming the posterior wall for the anterior mediastinum. And if you see behind, so the heart with pericardium is in the middle mediastinum. So that means the fibrous pericardium is forming the anterior boundary for the posterior mediastinum. So in front of the fibrous pericardium, that is anteriorly is the anterior mediastinum, posteriorly is the posterior mediastinum. Laterally, it is attached to the structures piercing the fibrous pericardium are there. So what are those structures? They are the pulmonary arteries and pulmonary veins. So the attachment of fibrous pericardium is below to the central tendon of diaphragm and above to the outer cords of the arch of aorta and pulmonary trunk, and it is also continuous with the pretracheal layer of deep fascia of neck. In front, it is attached to sternum by sternopericardial ligaments, and it forms the posterior wall of anterior mediastinum. Behind, it forms the anterior wall of posterior mediastinum. Laterally, it is pierced by the structures, the pulmonary arteries and veins. So the structures piercing the fibrous pericardium, let us summarize. So you are seeing in these two pictures the opened up fibrous pericardium and attached on its inner aspect the parietal layer of the serous pericardium, and this is the pericardial cavity. The visceral pericardium is closely attached to these structures. This is from the anterior view. This is the posterior view where you can see the blood vessels that are grouped. It is the aorta and pulmonary trunk in one group. Then all the other veins which we mentioned as they are the superior and inferior vena cava, a pair of right pulmonary veins, the pair of left pulmonary veins. These are the structures that are piercing the fibrous pericardium, and they are the aorta, the superior vena cava, right and left pulmonary arteries and 4 pulmonary veins. Though we have mentioned inferior vena cava here, that is not piercing the fibrous layer. It enters the pericardium through central tendon of diaphragm and it does not receive a covering from the fibrous layer. In front, the fibrous pericardium is related to the anterior margins of the lungs and pleura. On the left side, below the left fourth cartilage, it is related to the left half of lower 2 pieces of sternum and an area of superficial cardiac dullness. That means a part of the pericardium not covered by the lungs and pleura. The area of superficial cardiac dullness we will discuss in our subsequent slides. And in front, it is related to sternopericardial ligaments. Occasionally, remains of thymus can be seen in anterior to it. Then what are the relations posteriorly? Posteriorly is the posterior mediastinum, and in this picture you can see the division of trachea into right and left bronchi that are posterior relations for the fibrous pericardium, and the other structure is the esophagus, and this is the descending thoracic aorta. Here you can see the thoracic duct, and this is the agiogous vein on the right side. Similarly, on the left side will be the hemiagiogous veins. And the posterior parts of mediastinal surfaces of lungs also will form a relationship to the fibrous pericardium posteriorly. And this is a fetal thorax, and abdomen is also opened up. So below it is separated from the left lobe of liver and fundus of stomach by the diaphragm. So this is the diaphragm, which is the separating the left lobe of liver and fundus of stomach from the pericardium. So here you are seeing the heart from which the pericardium is reflected. Then these are the two lungs you are seeing. Then see in this one. So the one that is being reflected is the left lung. This is the anterior border of left lung, and there is a gap here. Because of that, the left part of the pericardium can be seen as superficial area of cardiac dullness. So here you are seeing the heart enclosed with pericardium, and this is the right lung, and this is the arch of aorta and its branches, the brachiocephalic, the left common carotid and the left subclavian. So on each side it is related to the cardiac impressions of the lungs that are separated by pleura known as the mediastinal pleura, and you can see the phrenic nerve here. This is the phrenic nerve, and which will be accompanied by pericardiophrenik vessels. On the left side, in addition, this is the ligamentum arteriosum that is seen here between the pulmonary trunk and arch of aorta, and the other structure is the left recurrent laryngeal nerve passing below the ligamentum arteriosum. So you are seeing the phrenic nerve and pericardiophrenic vessels, the left recurrent laryngeal nerve, the ligamentum arteriosum. And coming to the serous pericardium. Serous pericardium is thin when compared to the fibrous pericardium. Is thick and tough layer. The serous pericardium is a thin layer and it lies within the fibrous pericardium. It has got two layers, the parietal layer which is in contact with the fibrous pericardium, and the visceral layer or epicardium which is in contact with the heart. The pericardial cavity is between the parietal and visceral layers, and you are seeing the exposed pericardial cavity in this picture. And the serous pericardium is lined by mesothelium. The continuity between the two layers, that is the serous pericardium, two layers, that is the parietal and visceral layers, is in the form of two tubes around the great vessels. Now you know what are the great vessels. And the continuity between the two layers of serous pericardium is in the form of two tubes, one at the arterial end of developing heart, other at the venous end of the developing heart. In this picture, you are seeing the at the venous end of developing heart, how the layers are continuous. This is the outer layer or the parietal layer, and in relation with these veins in contact with them, this is the visceral layer. You can observe. So, the space between these parietal and visceral layers is the pericardial cavity. This is the pericardial cavity. So, at the venous end, that consists of superior and inferior vena cava, we are seeing the right and left pulmonary veins. So, this is the place where the parietal and visceral layers are continuous. If you observe this picture, because this part is shown here, which is easy for you to understand, and this is the arterial end, which consists of arch of aorta, you are seeing, and then the pulmonary trunk. So, enclosing this part, arterial end, also the parietal and visceral layers are continuous. You can see the continuity of the visceral layer with the parietal layer here. So, the two layers of serous pericardium are continuous with one another at the arterial end and venous end of the developing heart. Now, let us see the differences between the parietal and visceral layers of pericardium. Regarding the attachment of these layers, parietal layer is attached to the fibrous pericardium and visceral layer is attached to myocardium. Regarding the development of parietal and visceral layers, the parietal layer develops from somatopleuric layer of intraembryonic mesoderm, whereas the visceral layer is derived from splanchno-pleuric layer of intraembryonic mesoderm. The nerve supply of parietal and visceral layers differ. The parietal layer is supplied by somatic nerves, that is phrenic nerves. The visceral layer, that is derived from the splanchno-pleuric mesoderm, is supplied by the sympathetic chain, and parasympathetic is by vagus nerves. Since the parietal layer is supplied by somatic nerves, it is sensitive to pain. The visceral layer is insensitive to pain. Now, in this picture, you can see the pericardium and then the layers of pericardium with the space between the parietal and visceral layers of pericardium, that is pericardial cavity that contains the pericardial fluid, which is about 20 to 50 ml, and the function of which is to lubricate the opposing surfaces, that is the parietal and visceral layers. The purpose is to avoid friction between these two layers, and if the quantity of fluid is more than 300 ml, you call it as the pericardial effusion. The contents of pericardium. The contents of pericardium are the heart with the vessels and nerves, that is the phrenic nerves and pericardiophrenec vessels in contact with the pericardium. Then the ascending aorta, the pulmonary trunk, the superior vena cava, the lower half of it, the terminal part of inferior vena cava, and the four pulmonary veins. These are the contents of pericardium. What are the functions of pericardium? The fibrous pericardium is protective as it acts like a physical barrier. It prevents infection, and the fibrous pericardium is fixing the heart to the diaphragm and to the roots of the great vessels, thereby it is restricting the excessive movements of heart. Because it is inextensible, it prevents overfilling of heart and it restricts the excessive movements. It is supportive to the parietal layer of serous pericardium. Coming to the functions of a pericardial fluid and serous pericardium. The pericardial fluid lubricates the opposing surfaces of serous pericardium and reduces the friction, facilitates smooth and efficient movements. Now coming to the nerve supply, blood supply, lymphatic drainage and development of layers of pericardium. The nerve supply for the fibrous and parietal layers of serous pericardium are same. They are supplied by the phrenic nerves. And the visceral layer of serous pericardium is by the autonomic nerves, sympathetic and parasympathetic. Parasympathetic is by vagus nerve. Arterial supply for the fibrous and parietal layers of serous pericardium is by pericardiophrenic arteries, which are branches of the internal thoracic artery. Musculophrenic artery also supplies these two layers. Musculophrenic is a branch of internal thoracic artery. Then there are bronchial, esophageal and superior phrenic arteries, which are branches of descending thoracic aorta, whereas the visceral layer is supplied by the coronary arteries. Coming to the venous drainage, from the fibrous and parietal layer of serous pericardium, the veins drain into the pericardiophrenic and from there to the internal thoracic vein. And there is drainage through the azygos and hemiazygos veins. The visceral layer of serous pericardium drains into the coronary sinus. The lymphatic drainage for all the three layers of pericardium is by anterior and posterior mediastinal nodes and to the tracheobronchial nodes. Coming to the development of fibrous and parietal layer of serous pericardium, the fibrous layer develops from septum transversum along with the central tendon of diaphragm, because of which it is attached to it. Then the parietal layer, it develops from the somatopleuric layer of intraembryonic mesoderm. The visceral layer of serous pericardium, it develops from splanchno-pleuric layer of intraembryonic mesoderm, which is also known as myoepicardial mantle, so which gives origin to the myocardium and epicardium. Some time back, I have mentioned about the area of superficial cardiac dullness. Let us see what is this area of superficial cardiac dullness. Observe this picture. There is a triangular area and this area of superficial cardiac dullness is observed on percussion of the chest. And what is its extent? Left fourth sternocostal junction. At the junction of the fourth intercostal cartilage with sternum on the left side to the apex beat, which will be felt in the left fifth intercostal space medial to mid-clavicular line. So, the extent of this superficial cardiac dullness is from the left fourth sternocostal junction to apex beat. From the apex beat, it will extend to junction of xiphoid process and body of sternum. So, left fourth sternocostal junction to apex beat, from apex beat to junction of xiphoid and body of the sternum. What is the importance of this area of superficial cardiac dullness? This corresponds to that area of heart not covered by lung tissue. In this place, the pericardium is in direct contact with the inner surface of body of sternum because the anterior margin of left lung and pleura are away from the midline. So that's why it is called area of superficial cardiac dullness. And the importance of it is for the diagnosis of cardiopulmonary disorders. After studying about the pericardium, let us see what are sinuses of pericardium. The sinuses of pericardium are formed by the arrangement of epicardium in the form of two tubes at the roots of great vessels, and one is the arterial tube, the other is the venous tube. The arterial tube encloses the ascending aorta and pulmonary trunk. The venous tube encloses the superior and inferior vena cava and the four pulmonary veins. For understanding the sinuses of pericardium, the development of heart should be known a little bit. So this is the developing pericardial cavity and the developing heart tube. It gets incorporated into the pericardial cavity from the dorsal aspect, and for some time it is suspended from the wall of the pericardial cavity by means of a fold known as the dorsal mesocardium, and the heart tube shows an arterial end and a venous end. When it starts getting folded gradually, between the arterial and venous ends, there is the formation of the transverse sinus of pericardium, and behind the venous end will be the formation of another sinus of pericardium known as oblique sinus. So the foldings of heart tube are responsible for the formation of sinuses of pericardium, which are two potential spaces in the pericardial cavity. The arterial end and venous ends of the heart tube are coming closer. Now the heart becomes V-shaped with an anterior arterial component and a posterior limb or the venous component. What is the location of these sinuses? These sinuses are between the parietal and visceral layers of pericardium. In this picture, you can see the fibrous pericardium, and on its inner aspect, closely attached to it, is the parietal layer of serous pericardium, and the reflection of the parietal layer onto the visceral layer of the pericardium, the viscera, that is the right atrium and left atrium, into which it is reflecting, and you can see the two arterial tubes, that is the aorta, ascending aorta, the pulmonary trunk. Then this is the location of the transverse, sinus, and you can see behind the left atrium the oblique sinus. So the location of sinuses is between the parietal and visceral layers of pericardium. Because of the irregularity in the line of reflection of parietal layer, these sinuses will be formed. And there is a V-shaped space between the arterial and venous ends of the heart tube. So the two limbs of the heart tube are the anterior limb and a posterior limb. The number of sinuses of pericardium are the transverse sinus and oblique sinus. What is the location of the oblique sinus of pericardium? It is that part of the pericardial cavity trapped behind the V-shaped heart. It is behind the venous limb, and it is a recess that is entrapped due to reflection of the serous pericardium around the great veins. So you can see the left pulmonary veins here, then the right pulmonary veins with superior and inferior vena cava here. And in the adult, the oblique sinus lies behind the left atrium that forms the base of heart. So this space, that is the oblique sinus, is the space between the parietal and visceral layers of pericardium. That's why it is a parieto-visceral space. And it is in the form of a inverted J-shape, J-shaped appearance. In this picture, you can see the oblique sinus of pericardium. The fingers are inserted behind the heart and posterior to the left atrium that forms the base of the heart. So the boundaries for the oblique sinus of pericardium are anteriorly the visceral layer of serous pericardium covering the left atrium, and posteriorly is the parietal layer of serous pericardium lining the heart. The right boundary for the oblique sinus of pericardium is the visceral pericardium along the superior vena cava, the two right pulmonary veins and inferior vena cava. So this is the right boundary, and left boundary is the continuity of parietal layer with the visceral layer along the two left pulmonary veins. And superiorly, the boundary is the reflection of the visceral pericardium onto the wall of the pericardial sac. Inferiorly, the oblique sinus is open. So the right boundary is this part. This is the left boundary, and this is the superior boundary, and the inferior boundary is open. Coming to the transverse sinus of pericardium, it is called intervisceral space as it is between the visceral layers. So only visceral layer you are seeing here, and it is the gap between the pericardial reflection along the great arteries and the great veins. So this is the transverse sinus of pericardium, and it is formed by the degeneration of dorsal mesocardium, which is suspending the developing heart tube. Coming to the boundaries of the transverse sinus of pericardium, in this picture, the index finger is placed posterior to the ascending aorta and pulmonary trunk, and anterior to the superior vena cava and right atrium, and above the upper surface of left atrium, and below the bifurcation of pulmonary trunk. Now you can understand the boundaries of it. Anteriorly is the ascending aorta and the pulmonary trunk. Posteriorly is the superior vena cava, the intrapericardial part, and the right atrium. Below is the upper surface of left atrium, and above is the bifurcation of pulmonary trunk. It's about the boundaries of transverse sinus of pericardium. And in this picture, you can see the index finger is placed behind the aorta and the pulmonary trunk. That means it is in the transverse sinus of pericardium. After discussing the pericardium in detail and the sinuses of pericardium, let us look into the clinical importance of pericardium. There is what is known as the pericarditis, that is inflammation of pericardium, which is the common cause for chest pain in adults. And if the parietal and visceral layers of serous pericardium, if they come in contact with each other, which can happen if the lubricating fluid is not there because of the infection, then the two layers can rub against each other, causing what is known as pericardial friction rub, and it will be heard by stethoscope as the moving of the acyl cloth between your finger. So that will be the sound that will be heard. That is the friction rub. And if the amount of fluid that is accumulating in the pericardial cavity is more because of pericarditis, it is called pericardial effusion. So excess secretion of pericardial fluid due to inflammation is called pericardial effusion. So if the pericarditis untreated, which can be due to bacterial infection or tuberculosis or malignancy, that can lead to pericardial effusion. And if the excess fluid, it is the pericardial fluid in the pericardial effusion, is compressing the thin-walled atria, it is known as the cardiac tamponade. So cardiac tamponade is excess fluid compressing the thin-walled atria that interferes with venous filling of the heart during diastole, which is aggravated by the inelastic nature of the fibrous pericardium, and cardiac tamponade is a fatal condition. In this picture, this is a picture of ultrasound. Then you can see this is the pericardial space, and there is pericardial effusion you are seeing, and this is a picture of cardiac tamponade. Then there is what is known as pericardiocentesis. So if the pericardial fluid is more, it can be drained by passing a needle, and that procedure is known as the pericardiocentesis. In this, a needle is passed upwards and backwards at an angle of 45 degrees immediately to the left of the xiphoid process, in the angle between xiphoid process and left costal margin. So if it is passed in this direction, the needle will not injure the pleura or the lung. So now you know what is pericardiocentesis. The hemopericardium is a collection of blood in the pericardial cavity, which may be due to injuries or postoperative bleeding or perforation of a weak myocardium. Then there is what is known as pneumopericardium, which is collection of air in the pericardial cavity, and this happens in patients with pneumothorax, where there will be air in the pleural cavity. That air cuts through the connective tissue and enters the pericardial cavity, that is known as the pneumopericardium. Then regarding the clinical importance of transverse sinus of pericardium, which is important for the cardiac surgeons. And in the case of coronary artery bypass grafting, so they will be passing a surgical clamp through the transverse sinus or placing a ligature around the aorta and pulmonary trunk, so that they can insert the tubes of a coronary bypass machine and then tighten the ligature. So surgeons can stop or divert the circulation of blood in these large arteries while performing the cardiac surgery. So that is the importance of transverse sinus of pericardium. Then now let us come back to the clinical case which was presented at the beginning of this lecture. Patient of 35 years old attending the medical OP with a complaint of mid-sternal pain of 2 weeks duration, more in lying down position or supine position, or when the patient coughs or takes a deep breath, and relief of pain in sitting position, and the pain is also felt in the left shoulder. There is a history of sore throat before the onset of present symptoms. Then the diagnosis that was made was acute pericarditis. Now let us answer the questions in relation to the clinical case scenario. What anatomical knowledge is required to diagnose this condition? Anatomical knowledge of pericardium is required for diagnosing this condition. And how will you explain the relief which the patient is getting in sitting position? When the patient is in supine position or lying down position, because of the redistribution of blood, the symptoms will be aggravated, and more so when there is cough or deep inspiration. When seated or when leaning forwards, there will be reduced pressure on the parietal pericardium, particularly in inspiration. What is the explanation for the pain felt in the left shoulder? So there is what is known as referred pain, pain perceived at a location other than the site of painful stimulus or origin, due to the interconnecting sensory nerves that supplies many different tissues. The pain will be felt in the area of distribution of the same segmental nerves. In the present case, the pain of acute pericarditis will travel to the left shoulder and neck because of innervation by same segmental nerves, that is C3, 4, 5, that supply the fibrous pericardium and shoulder. Oh, now we have understood the pericardium, the pericardial sinuses or sinuses of pericardium, and the clinical importance of the pericardium.